Bismillah ar-Rahman ar-Rahim. In the name of Allah, the most merciful, the most gracious. This is Ahmad Zahran speaking, and welcome to our lecture for today. And after we've finished everything that is related to the anatomy of the brain and the cerebellum and the brainstem, the cranial nerves, and even the cranial vessels, and we've talked in the previous lecture about the meninges that cover the internal structure within the cranial cavity, we finished everything that lies inside the skull, inside the cranial cavity. I think it's about time to talk about the anatomy of the skull. If you look at this amazing cake in here, it has a special shape. And you ask yourself, how did they make this cake with this shape? Well, actually, it's very easy. They just got a metallic template, as you can see here, and they just put the cake dough inside, and they put it in the oven, and finally you get this amazing cake. So, the cake was made according to the shape of the template. That's very easy, and I think that's very logic. Okay. But what does this have to do with the anatomy of the skull? Well, actually, the skull is the cake, while the internal structures are the actual templates around which the skull was formed. So you mean that the skull was formed after the internal structures? Well, actually, something like that. The skull will take the shape of the internal structures. It's not just a skull with a cavity inside that is going to be filled with brain and cerebellum and brainstem and nerves and vessels. No. There was a brain, there was a cerebellum, there was a brainstem, there were nerves, there were vessels, and around them the bone was formed, taking the shape of the structures that is inside, and forming the shape of the skull that we know now. The skull is a bony structure. Yes, it's a bony structure that is actually formed to protect the internal structures, to protect the brain, the cerebellum, the brainstem, and the nerves and the vessels. And that's why this bone was formed around its template, and the template was the internal structures. But I said something wrong in here. I said that the skull was just a bone. Well, it's a bony structure, but it's not just a bone. You have to know that the skull is formed of 28 bones that came close together, and surrounded the internal structures to form the structure of the skull. Okay, so we have 28 bones that came close together, forming the structure of the skull. These bones will come close together and become very near to each other until they even attach to each other. They fuse together to form the structure of the skull. If you look at this picture in here, what is that? This is the skull of a baby, a newly born baby. And you can see here what I've mentioned, that the skull is not just one bone, it's just a group of bones that came close together to surround the internal structures. But wait a minute, these bones are not fused yet. There are gaps that you can see between these bones. Oh yes, this is right. The bones are not fused, they are separate bones, and there are gaps between these bones. Okay, well actually this has two reasons. The presence of gapping between the skull bones has two reasons. The first reason is that during delivery, the baby has to pass through a narrow passage, which is the vagina, and in order to pass within this narrow passage, the skull could be squeezed a little bit, and this gapping will allow molding of the skull bones to pass through this narrow passage. Okay, so this is the first reason. The second reason is that after birth, the brain is not ready yet. The brain is not fully developed yet, and it needs to further develop and grow after birth. But if these bones were actually fused together, forming a closed cavity, a closed cranial cavity, the brain will not be able to grow. Oh my God. And that's why there were gappings between the bones to allow the brain to grow and increase in size without any increase in the intracranial tension, without any compression of the brain. As the brain grows, the skulls move further away from each other using the gappings that are present between them, and the brain can grow safely. And that's why these bones have gappings between them. But if you look here, you can find that the gaps are of two types. There are two types of gappings between the bones. We have streets or straight gaps here, and we have holes. Okay. If two bones come close to each other, the gap between these two bones is a street that we call a suture. So the suture is actually a gap between two bones of the skull that are coming close together. Okay, what about the holes? When more than two bones come close together, 3 or 4 bones come close together, they form a gap between them that is like a hole, and we call it a fontanelle. Okay, that's nice. So I think now I understand that. The bones of the skull are coming close together, but they are not fused yet during birth to give a chance for delivery, safe delivery, and allow the skull to be squeezed inside the vaginal passage. And they are also having gapping to allow the brain to grow safely without squeezing on it. That's nice. Okay. And we have two types of gaps between these bones. We have sutures that are linear gaps between two bones close together in the skull, and we have fontanelles that are actually holes that are gappings between more than two bones that are coming together within the skull. Okay, that's very nice. That's very nice. Okay. So, what I know now about the skull anatomy is that the skull is a group of bones, actually 28 bones. We're going to know that after a while. And these bones are actually going to surround its template, which is the cranial structures, the intracranial structures. They're going to surround it and protect it, okay? And these 28 bones are actually not fused from the beginning. They just come close together, and there are gappings between these bones to allow safe delivery of the child through the vaginal passage and to allow the brain to grow safely without any pressure on it. And we know that there are two types of gappings between these bones. We know the sutures, which are linear gaps between two bones that are coming close together. And we know the fontanelles, which are holes that are formed when more than two bones are coming close together in the skull. Okay, that is really nice. But there's an important question in here. Are these sutures and fontanelles going to remain forever? Well, actually not. They are not going to remain as gaps. These sutures and fontanelles are actually going to fuse. The bones that are close together are actually going to fuse together after full brain development. We no longer need any gapping between the bones. The brain is fully developed now. Okay, so these bones are going to fuse together and form the structure of the skull that we all already know. And now, if you look at this adult skull, it's formed of fused bones. And even here you can see that there are fused sutures that are present between the different bones of the skull. Oh my God. I guess you mean that this was a bone, this was a bone, this was a bone, and there are sutures, lines that are present between these bones, telling us that one day these bones were separated and there were gappings between them, but then after birth and after full development of the brain, they all fused. How amazing is that? If you look at the skull here, you find that you can divide the skull into two parts. There is this part in here, which is rounded like a ball in here. And then there is this part, the anterior part in here. This ball is going to protect the brain, the cranial structures. And it's actually composed of a cranial cavity. It's actually a cavity from inside. So this ball in here is going to protect the brain, so we are going to call it the neurocranium. The neurocranium. It's the part of the skull that is going to protect the brain. Okay. What about the other part in here? What is that? This is the face. These are the facial bones. Okay, these are the bones that are going to make the structure of the face. And we're going to call it the viscerocranium. The viscerocranium. So we have the neurocranium and the viscerocranium. The neurocranium and the viscerocranium. And each of which, the neurocranium and the viscerocranium, is composed of several bones that came close together, forming sutures and fontanelles, and then they fused together after birth, forming the full structure of the skull. Okay. And if you look at the neurocranium, the ball in here, the neurocranium, you can find that the neurocranium is actually formed of a cap in here that we call the clavaria of the skull. This cap here is the clavaria of the skull. And from below, you can find that there is a skull base. A skull base. This is the skull base. Okay, you can see the skull base from inside, and you can see the skull base even from below. Okay, that's nice. So I know that the neurocranium, this ball that we know very well now, this neurocranium, is composed of a clavaria or a skull cap and a skull base. And you can see the structures of the skull base as you look from inside the skull cavity, and as you look at the skull cavity, and as you look at the skull from below. And as we are going to study the anatomy of the skull, we are going to study each bone. These bones could be present only in the clavaria of the skull, or they can be present only in the skull base, or they can be present in both. And now we know very well that the skull is composed of several bones, actually 28 bones that came close together, forming the structure of the skull. We know the sutures, we know the fontanelles, and we know that the skull is composed of a neurocranium and the viscerocranium, and the neurocranium is composed of the clavaria and the skull base. And now, as an introduction to the anatomy of the skull, today we're going to give a short hint about the 28 bones that are going to form the skull before studying each bone by itself in a separate lecture. And let's get to know these bones one by one. In the beginning, we have to know something that's very important, that the 28 bones are divided into two types. We have 11 paired bones. Paired bones, that means that we have a bone on the right side and a bone on the left side. Same bone, it's paired. We have right and left of the same bone. Okay, so these are 11 paired bones. And we have also 6 unpaired bones. They just come by one, just one bone that is present. Well, actually, the 6 unpaired bones are bones that are present mainly in the midline. So they have right and left representatives of the same bone. But the bones that are present on the sides, they can be paired. They have paired bones, right and left paired bones. We have how many unpaired bones? 6 unpaired bones. And how many paired bones? 11 paired bones. And collectively we have 28 bones forming this skull. Let's get to know quickly the 6 unpaired bones. The first bone we have in the unpaired bone is the frontal bone. The frontal bone. That's the bone that's present in front of here. Yes, the frontal bone. And you can see the frontal bone, as you can see here in these pictures and in this skull as well. You can see that this frontal bone, you can see it from front. You can see it from the side, in here. You can see it from above. Okay, you can see it in the clavaria of the skull. And even you can see it from inside. You can see the skull, the frontal bone of the skull from inside. And this is the first unpaired bone that we have to know. This is the frontal bone of the skull. Okay, that's nice. That's nice. What's next? The second unpaired bone that we have here is the occipital bone. The occipital bone, okay. And it's from behind. Okay, this is the occipital bone. I can see it from the back, and even I can see it from below, from the inferior aspect of the skull base, and I can see it from inside. Yes, in here, it's present in the posterior part of the skull base in here. Okay, so this is the occipital bone. So now I know the frontal bone and the occipital bone. These are two unpaired bones. Okay. What else? What else we have as unpaired bones? There is a very important bone that is lying within the skull base, actually. It's present in the skull base mainly, and this bone is called the sphenoid bone. If you look at this picture in here, this sphenoid bone looks like a bat. A bat with a body and wings. Okay, it's called the sphenoid bone. It's a very important bone. It's a very important bone, the sphenoid bone. And this is one of the unpaired bones. Just hear the names. The sphenoid bone. The sphenoid bone could be seen actually in the skull base in here, if you look at this cranial cavity. And you can see also the sphenoid bone from below, from the skull base from below. Okay, and you can even see it from the sides of the skull, as you see in this picture here. Yes, this is a part of the sphenoid bone as well. Okay. Thank you very much. This is the sphenoid bone. So now how many bones do I know about the bones of the skull? I know 3 unpaired bones. I know the frontal bone, the occipital bone, and from inside I know even the sphenoid bone. Thank you very much. Thank you very much. What else? The fourth bone we have to know is called the ethmoid bone. The ethmoid bone. It's actually present inside the nasal cavity, between the nasal cavity and the orbit. This is called the orbit, where the eye is lying. Okay? This ethmoid bone is a bone that has many parts. We're going to study that in its lecture, inshallah. This bone is present inside the nasal cavity, between the nasal cavity and the bone, and it's even, you can see a part of the ethmoid bone here in the skull cavity or in the cranial fossa inside the cranial cavity. This is called the ethmoid bone. Just hear the names. And we're going to study them afterwards in details. So I know 4 bones now of the skull, 4 unpaired bones. The frontal bone, the occipital bone, the sphenoid bone, and the ethmoidal bone. What else? Inside the nasal cavity as well, there is a bone that is present in the nasal septum, between the 2 nasal cavities. This bone is called the vomer. The vomer. Okay, so this is another unpaired bone, the vomer. And finally, just to finish the 6 unpaired bones, we have another unpaired bone, which is the mandible. The lower jaw, the mandible. This mandible is one of the unpaired bones. So now I know 6 unpaired bones. 6 unpaired bones of the skull. Let's get to revise them now. We have the frontal bone, the occipital bone, the sphenoid bone, the ethmoidal bone, and in the nasal septum we have the vomer, and finally we have the mandible. The frontal bone, the occipital bone, the sphenoidal bone, the ethmoidal bone, the vomer, and the mandible. Thank you very much. So, now I know that we have 6 unpaired bones. What about the 11 paired bones? Okay, let's get to know them. The first one of the paired bones is called the parietal bone. The parietal bone, and you can see the parietal bone forming most of the clavaria of the skull, the parietal bone. We have two parietal bones, right and left parietal bones, and even you can see that there is a suture joining the two parietal bones together. It's called the sagittal suture. Just hear it now. It's not important for today, but there's a suture that joins the two parietal bones, the right and the left parietal bones. You can see the parietal bones here as you look at the skull from above. And if you open the clavaria and look from inside this, also you can see also the parietal bone. And this is the first paired bone we have. It's called the parietal bone. Okay, thank you very much. The second paired bone is called the temporal bone. It's present in here in the sides. The temporal bone. This is a very important bone as well. The temporal bone. It's present in here. This is the temporal bone. You can see it as you look at the skull from the sides, and if you look even at the skull base from the cranial cavity inside and from the skull below, you can see also parts of these of this temporal bone, which is the second paired bone. We have two temporal bones, one on the right side and one on the left side. So now we know two paired bones that are the parietal bones and the temporal bones. Okay, thank you very much. Thank you very much. What else? The maxillary bones. The upper jaw, the maxillary bones. These are actually two bones, one right and one left maxillary bones, and they fuse together in a suture. And here it's called the intermaxillary suture. Okay, so we have two maxillary bones. Thank you very much. Okay, what else? We have two zygomatic bones, the cheekbones. This is called the zygomatic bones. We have one right and one left zygomatic bones. Okay, thank you very much. We now know four of the paired bones. We know the parietal bones, we know the temporal bones, we know the maxillary bones, and we know the zygomatic bones. Okay, what else? There are small bones. The remainder are just small bones, okay? Above the nasal cavity here, there are two small bones that we can see here. They are called the nasal bones, okay? The nasal bones. And inside the orbit, there is another bone in here that's called the lacrimal bone. We have one right and one left lacrimal bones, okay? And here, behind the maxilla, just behind the maxillary bone, if you look at this maxilla, just behind the maxillary bone, if you remove this mandible, you can see that there are bones in here behind the maxilla called the palatine bones. The palatine bones, just behind the maxilla, the palatine bones. There are actually two small bones inside the nasal cavity. They are separate bones that are called the inferior nasal concha. The inferior nasal concha. We have two inferior nasal conchae, one right and one left. And finally, we have six bones, or three paired bones, that are present inside the ear, inside the middle ear actually. These are called the bony ossicles of the middle ear. We have three of the bony ossicles. We have the malleus and the incus and the stapes. These malleus, incus, and stapes, they are paired bones, one right and one left, malleus, incus, and stapes. And these are the paired bones of the skull. We know 11 paired bones. We have two parietal bones, two temporal bones, two maxillary bones, and behind them two palatine bones. We know two zygomatic bones, two lacrimal bones, two nasal bones, and two inferior nasal conchae, and finally 6 of the ear ossicles. We have two malleus, two incus, and two stapes. How amazing is that? That is all for today as an introduction to the anatomy of the skull. We got to know today that the skull is composed of 28 bones that came close together to surround its template. What? The internal cranial structures, the brain, the cerebellum, the brainstem, the nerves, and the vessels. These bones gathered together and came close together to surround them and form the structure of the skull. We know that these bones after birth were not yet fused, having gappings between them to allow safe vaginal delivery and to allow the brain to grow safely after birth. And then they're going to fuse after about 2 years after birth. Okay, these gaps are two types. Either we have linear gappings that are called sutures when two bones come close together, or we have the holes that are called the fontanelles when more than two bones come close together, they form this fontanelle. But all of these gaps, either sutures or fontanelles, will fuse together and the skull will be formed as one bony structure that surround the cranial structures. Okay, we know that the skull is composed of two parts. This bone here is called the neurocranium that surrounds the brain and the neural structures inside. And we have the viscerocranium, which are the bones of the face. We know that the neurocranium is divided into two parts, the clavaria or the skull cap and the skull base. This is the skull base, as you can see from the cranial fossa inside here, and even you can see the skull base if you look at the skull from below. And we know that the skull is composed of 28 bones, of which 6 are unpaired bones, and we have 11 paired bones. What are the 6 unpaired bones? We have the frontal bone, the occipital bone, the sphenoidal bone, the ethmoidal bone. What else? The vomer and the mandible. And we have 11 paired bones. What are the 11 paired bones? We have 2 parietal bones, 2 temporal bones, 2 zygomatic bones, 2 maxillary bones, behind them 2 palatine bones, and then we have 2 nasal bones, 2 inferior nasal conchae inside, 2 lacrimal bones, and finally we have 2 paired bony ossicles that are present in the middle ear. There are 2 malleus, 2 incus, and 2 stapes. This is an introduction to the anatomy of the skull. I hope you do understand it. In the next lecture, inshallah, we're going to talk in details about the anatomy of the frontal bone. Don't forget to subscribe to our channel and become a member of Neuroanatomy in English playlist. See you next lecture. This is Ahmad Zahran.